sharing is caring. And if once we share, other homeopaths will learn and homeopathy will grow. With homeopathy's growth, your own growth also happens. Always remember, in allopathy, one drug has been invented and given it to the allopathic world. So many patients get well, and therefore homeopathy is very well accepted with the documented proofs. Even though there are some side effects, but today it's a number one science. I always say allopathy is my father's science and homeopathy is my mother's science. So the combination of both has helped me in understanding homeopathy in a scientific way. There are so many drugs that has been given different materia medica in a different type. So I have read the materia medica with classical prescriptions, with physiological prescriptions, with pathological prescriptions. And then with the knowledge, for example, digitalis. Digitalis is a drug used even in allopathy for heart diseases, wherever there is a rhythm problems. And same digitalis in homeopathy in a different way with the physiological actions, considering mind. You know, I always used to say during my MD days, ki, sir, every disease, what is the first cause written by every student is idiopathic. What is idiopathic? So I used to ask, sir, what is this idiopathic? Sir used to say, this no one knows. I said, sir, no one knows. Then our science has become advanced so much. Why no one knows the cause? Then there are secondary causes, they used to say, air pollution, smoking, alcohol, bad habits, and all those things, lifestyle diseases and all those things. They are predisposing causes, but the main cause was not known. And this idiopathic has haunted me till the time I became a homeopath. In homeopathy, mind is the cause of all the diseases. A disturbed mind is the sole cause of all diseases, even from common cold to cancer. And therefore, when I found that understanding of idiopathic causes, I was very, very excited and happy. That made me go deeper into the homeopathy. But before that, I was a staunch allopath, very much against homeopathy. And I never used to believe homeopathy because allopaths are so hardcore trained that it is very difficult for them to accept the things which are not been proved in the frame of the science, in the frame of the research. Evidence base is not been included in that because evidence base is for the single cases and research is for the multiple cases with the protocols. So there are fixed pattern where you don't have to break this disease, this protocol, this disease, this protocol. No doubt, allopathy is a good science if it is judiciously used, but taking the shortcuts and all those things, it causes a problem also. Similarly, when I joined I quit all the jobs in Mumbai and went to Jalgaon for my mother's case. Mother was crying, you can't come and stay with me. How long you are going to study? I had to deny the red carpet welcome in the Hinduja hospital as a head of the department, respiratory medicine, or go to Jalgaon was a choice. I went for my mother. There she was. I started my own nursing home, and there she was serious. And after that, with ICU, I had one day while practicing, I was the only person who in the whole of the Khandesh putting temporary pacemaker in the heart because once the heart attack is there and there is a heart block with the hypotension, pacemaker helps even to resuscitate without giving cardiac shock. And in that week, when my mother was sick, she was in the last stage, and I had given up hope. I was crying in front of the God, and the book came of Kent. When I turned my face, it was given by my friend long back ago. I used to open, I said, what is this? I can't understand. There is a language of allopathy in the book. So I could understand some part of it, but how to apply it? Like we have got fixed protocols in allopathy, there was no protocol. One remedy is working on so many types of problems. So which one to apply was a big question. So I opened the book and saw Rs iode. One dose of 200 made a great difference in 24 hours from the multi-organ failure, PP not recordable, means almost Some few hours were left for her to leave this earth, and that arsenic iode worked so nicely. 24 hours she was settled, 48 hours all gadgets were out, and for 72 hours a patient in a deep coma getting up so fast. It was unbelievable, and asking for food. So many times when we give homeopathy, people say, "मेरा energy level बढ़ गया है, मुझे भूख लगी है." So that shows that mind becomes sound, and therefore the disease is controlled by your own immune mechanism. Physiology is corrected, brain is functioning properly, autonomic nervous system is working properly. That is what we call in homeopathy as a vital. The vital force is all the functions of the body, that is internal intelligence system, IIS. So that has been given by the nature for us, and that protects us from all diseases. When the mind is disturbed, this system gets disturbed, vital comes down, and then you develop a disease. So it's a very big topic. I'll not go more on that. So we come to the main topic today. First of all, I would like to congratulate Manish for OCHA webinar series for homeopathy awareness, what he has started. He has really done a great job. And I think he, what is the going on series will definitely educate the students as well as doctors who are practicing as doctors. All list I have seen, they are great teachers, they are great doctors, and everyone is contributing and everyone is equal. So before starting the main lecture, uh, I'll start with the slide of Dr. Hanneman. Are you able to see the slides? Okay, thank you. The tribute to our great master, Dr. Christian Frederick Samuel Hanneman. He was a great man who was an allopath, and he turned to he shunned his practice because people were dying more by the treatment than by the disease. So these side effects are still haunting us, but that time there were no major drugs. What is today's advanced conventional science was not there, but it was being practiced with a quick results, and therefore we have more quicker results in homeopathy, but we must know how to use it. So my tribute to our great master who has given this wonderful science to us for the well-being of the human beings in a most natural, gentle, rapid, and permanent restoration of the health. That was his main aim, and for which he got a success. So his legacy lives on. His legacy lives on not only in the remedies that we prescribe, but in love, care, respect. As we walk the path he carved with wisdom and integrity, may we survive to uphold the spirit of homeopathy with the same passion and purpose that defines his extraordinary life. But here, what he has written, dare to be wise. Every one of us speaks dare to be wise, but where we dare? Huh? To take homeopathy ahead with the modern scientific time? No. We need an Organon's 7th edition to match with the modern scientific time. Only then we can be at equal, at par with the protocols that are going to give concrete results, and therefore homeopathy will be ahead. Many times while doing my BHMS, I was a very older teacher-like person appearing for the paper in the examination hall. So students used to get, "Arey, examiner, I say I am a student." It was such a nice experience for me. I used to sit with the student, talk to them, and everyone used to say, "Ki, why you are doing homeopathy?" Ki, "Sir, homeopathy karega. Uske baad mein take some experience in the allopathy and start our practice with the allopathy." I said, "Why?" When a person like me is coming to homeopathy, that means there is something. I am not a fool to leave my empire at this, and therefore it is very, very important that homeopathy is definitely good. Then one of the student who had an accident, she said, "Ki, I have taken analgesic, this, that, and because today is a paper." So I say, you do one thing, take arnica, uta, hypericum. Because in accident, nerve gets damaged, muscle gets damaged, tendon gets damaged. And arnica is good for repair. Only take three doses at a distance of half an hour because it is an emergency. And next day you will see it works more better than allopathy. And she came and she said, "Yes, sir, today there is no pain. I am not limping also." So that is a great power of homeopathy. I said, "Then now have you changed your desire to be a homeopath?" But sir, it is very difficult. Everyone has got a different way of thinking. We get confused. When we give the medicine, patient doesn't get better, patient leaves us. I said, you have started the practice? No, we give to the home people. I said, then now you try to first understand the pathology, the physiology, and the nature of a patient, constitution of the patient is the last. When you start with an acute management, first relieve the pain, first give the immediate effect, and then come to a constitution. It will be faster, better, and in a more concrete way. So today we bow our heads with a deep reverence and gratitude to the visionary healer pioneer, Dr. Hahnemann, on his anniversary of his birth. A man far ahead of his time that time, dedicated his life understanding true nature with courage, intellect, unwavering commitment to the humanity. He gave the world homeopathy, an art and science rooted in compassion, gentleness, profound principles of similia similibus curenta. Now, what is this? The similarity of the symptoms and similarity of the symptoms produced by the medicine. This is very important, but it's so mm, confusing in many times. Where what should be used as acute, what it should be used as chronic. So when acute is presented, the symptom should be similar to the acute symptoms. The medicine should come into the repertorization. Always do a repertorization even for the acute. And then once you take care of that symptoms immediately, rapid within 24 hours, then you can see the results of the individualization of the constitutional remedy. He saw beyond the symptoms to the soul, honoring the individuality of every human being, teaching healing must begin with the understanding of a whole person. This is 100% correct because when till the time you give a whole person a treatment after chronic, the permanent recovery doesn't happen. It takes time, but at least patient is relieved because if he's not relieved, he goes to another doctor into the conventional science, and then where homeopathy gets the disregards and defames. And therefore, his legacy lives on, not only in remedies we prescribe, but in love, care, respect for each patient. As we walk the path he carved with wisdom and integrity, we may strive to uphold the homeopathy with the same passion and purpose that defined his extraordinary life. And I pray and thank Dr. Hahnemann. He is a God to us, all human beings, and it has given a great importance of what is a health, understanding, as well as fast and permanent restoration of the health in properly well given medicines. My introduction is already being given. So we first come to other COVID cases. Today I have divided. Manish told me first the COVID protocols. I said I'll give that. Then he said yesterday कि sir कुछ और भी extra डालेंगे तो अच्छा है. So I have covered into three parts. First is the COVID cases, then ICU serious cases, and then after that integration. So we must learn all three things because once the cases they come, we must know how to proceed and how to take a case. So this was the first case during that time, the first wave of COVID, when I was prescribing a classical remedy and I was not getting a result. I was not taking care of the acute symptoms, pathology. Then I said the first case died, and it was a very pathetic situation for me. I was feeling very bad. I was absolutely in the deep grief with frustration and failure. When this so meticulously chosen, well selected remedy didn't work and patient deteriorated because I didn't manage the acute symptoms and the deep pathology that should be given as medicines we have in our repertory. If you search in journals and the particular chapters, pathological remedies we have, then we have to match that, keep it in another folder. And first is the symptoms in the first folder. Second is the generalities, modalities. And third is the pathological remedy. One by one, you select and you'll find a series of remedy and you can yourself form the protocol. Because when you give protocols, what is the best thing is that patient gets controlled faster, patient stabilizes, he gives us time to treat with the individual cases, and then the recovery is final in the best. So during that time was a time when homeopathy was restricted. We had fought a lot. Manish knows that in the task force, we had a tough time for homeopathy. But I was fighting up to the neck, tooth, and everything to say that this homeopathy has a great science and will show us the uh, results, research. I said, sir, Central Council of Homeopathy has appointed me to carry out all the researches in this COVID virus for whole of the Maharashtra. I was given authority by the chairman of the committee. Here I took this, but they were not giving hospitals, and our homeopathic hospitals are not there. So it was such a time frustrating this and that time. I said, now what to do? So those who were very near, close, who were having faith, I said, next, I should be very much clear. So I saw one postmortem report of a COVID patient, first time done in Italy. And there I've seen the pathology. I said, first I have to understand the pathology and then select the homeopathic remedies. So the pathology was main, two important pathology. One is COVID virus was biting the blood vessels and licking the nerves. So where there are nerve symptoms, these symptoms were not there of COVID pneumonia. See what wonderfully Dr. Hanneman has given into the organon, that one disease expresses at one time only one disease. When it finishes its course, second disease comes. So I understood. Now I have applied this organon pathology, modern science, and thought I will make a protocol. I made a protocol. What is the constitutional should not be given during the acute phase, because many a times disease aggravation and final decline happens because the vitals are low. So first we have to point, see blood pressure, oxygen, everything. These are vitals. What is the immunity? And find out. First you have to start with these remedies. So first was that first give oxygen. So we should know how much of oxygen to be given, and that has to be properly placed. So second time, because of this, I was very sure how can I handle this case, and luckily that time, uh, I cannot call it luckily, but the situation was worse. Beds were not available, and because of the beds, patients were dying outside in the hospital corridor without having oxygen. At least oxygen was a must that time. With only oxygen, you can save so many lives. But that was a bad scenario. This is a COVID pneumonia with severe hypoxia and ARDS, managed with homeopathy and minimal oxygen support at home. It was really very exciting for me. For at the same time, I was on my nerves with anxiety, fear. What if I fail and he dies at home? My degree will be cancelled. Legal actions will be taken against me. So I told the patient, she was 65-year-old, ki, I can't do. You search for hospitals, sir. There are no hospital beds available. I will die, please. You have taken oath, you are a doctor, that whosoever comes to you, you will help. I said, but these calamity laws are there that homeopathy and Ayurveda was not allowed. He said, leave about that. I'm begging for my life. And no one will blame you, even if something goes wrong with me. I know. Anyway, people going there are dying. So at least if I die at home, I will have proper cremation. That were his words. It it moved me, and I said, come on. Now here I have to be dare to be wise. So he presented with severe generalized weakness, severe breathlessness, low-grade fever with muscle aches, critically low oxygen saturation, blood pressure was maintained. That was a good vital. So I said, come on, we have got this vital is good and we should get. And cyanosis and visible discoloration of extremities to the blue. So you can imagine how bad was this case. So due to acute shortage of the beds, I got this opportunity. And then I said, okay, I'll manage you at one condition, that you have to manage to get a jumbo oxygen cylinder. And he was living in the remote area. So jumbo oxygen cylinder was brought on a bullock cart. And we said, first start with 5 liters of oxygen, always to be this. So I structured the integrated management that time with oxygen, sorry, with the oxygen support. So oxygen is of the modern science. So the minimal integration without using more drugs. So administered bryonia and carbovage to address the hypoxia. First was to improve the hypoxia. Then second was monitoring and communication. Every 15 minutes, I used to do video call, monitor, show me this, show me his face, take his, show me the pulse, what is the oxygen level. After every dose, in 5 minutes and 10 minutes, if oxygen was not improving, I used to change the remedy because time is not there. If you give one remedy and see, हाँ शाम को देखेंगे तो शाम को रहेगा नहीं patient. So management of this type of was I have worked for 5 years in ICU, different types of ICUs. So I was already trained to be on the toes, always be vigilant, and with a pure desire to save the patient. Then only you can do this type of cases. So every 15 minutes, the video call was going on. Improvement of oxygen saturation happened after bryonia and carbovage 30. I'm giving you the potency also. Bryonia 13, carbovage always to start and then immediately go if it's not sustaining to 200. And if we require more repetitions, then better give water repetitions so that you are safe. Now, this is also not known very clearly what happens because that needs to be research studied so that we all homeopaths get a proper direction. So oxygen was 30 to 40 at the start. Can you imagine? The patient was blue and that too without any, except for oxygen support and bryonia and carbovage, this patient was brought to for 50 to 60 in a matter of 3 or 4 hours. So fast. And immediately, means it used to increase. 30, 45 हो गया sir. अभी 50 हो गया sir. अभी वापस नीचे आ गया sir. वापस 50. This was the monitoring. Huh? And once the oxygen started with this, only bryonia and carbovage gave improved to 50, 60. It was not increasing above because there is a alveolar damage in COVID pneumonia. We started with 5 liters per minute and oxygen raised to 80, 90% within 3 hours. So it was say, come on now, at least patient can survive with 80, 90. And he was already a heart patient. So it was a challenging job. So challenge with movement. When patient he used to go to washroom, I said, no, give him bedpan. Sir, घरी काही नाही काय करू ते ऐकत नाही. So oxygen level used to fall down to 40, 50, but his vitals were good. And for that, I said, whenever, before going to toilet, you should give Cactus G6C because it improves cardiac circulation. Management of the serious cases, you must first focus on the heart because once the heart is good, patient will survive. He will give you time to manage. So we added that and he was less breathless. So particularly in a happy hypoxia, patient never used to know that he's getting heart problem. We can analyze that whether the heart is involved with the pulse rate. Pulse rate used to increase 120, 130. That means heart has to pump more blood to maintain the circulation against the systemic vascular resistance. So solution for mobility, I said, now what you do, get a long tube, put it in the bathroom so that he goes there and then takes the oxygen. And that is how we maintained him. So with that, water problems, I used to give intercurrent remedy. Now we increased the dose of bryonia to 200, 4 doses daily to address the core symptom picture. It was a genus epidemicus. Veratrum viridi and ferrum phos were the remedies that was very important for the involvement of the blood vessels. If you see general chapter in the repertory, in general, inflammation of blood vessel, vasculitis, there is a rubric, and you see all these remedies. From there we picked up. And what was Viratum viridi? It downs the blood pressure as well as inflames the capillaries so that the fluid goes out. And that is how the pneumonia used to happen. So Veratrum viridi with ferrum phos work well. That I used to select one of the remedy. If the blood pressure is low, Veratrum viridi, blood pressure is not low, ferrum phos 30. But these cases required repetitions. Kalicar was given for the heart, oxygen as well as respiration support, along with carbovage. Kalicar, carbovage, bryonia, carbovage. So that improved. And abrotenum 200 was given for inflammation of the lungs. Now, IL-6, whenever the CRP is high, and IL-6 is high. Anti-inflammatory that works best without giving side effects is abrotenum 200. Abrotenum 200, uh, I can tell you it is our homeopathic steroid. Now it has no actions like a steroid giving side effects, but it controls the CRP and IL-6 so fastly. So I had become master that time in COVID after this first case was a learning. And what I applied my mind, dared to be wise by using homeopathic drugs in combination, not mixing all together, but spacing the medicines as per the severity, 20 minutes, half hour, 1 hour, and finally, uh, the recovery was fantastic. So Cactus G was given to improve coronary circulation. It is our homeopathic sorbitrate. Whenever patient has an angina, there is nothing. You just put 10, 15 pills of Cactus G, patient immediately settles down. You can save the heart attack. You can save so many things of the patient. Give life to the patient. Secondly, never give 100% oxygen. It causes oxygen insult and death. So many 40 liters of oxygen, 20 liters of oxygen. It causes lung damage. Alveoli cannot take high oxygen. It cannot take low oxygen. And that was a big mistake that was happening during COVID time. Patient used to be on ventilator. No one was monitoring everything. And finally, oxygen, ATP drop हो गया, increase the oxygen. अरे वो जाएगा नहीं ना, तो 10 though, 20 though, 40 liters though, oxygen will not improve. As a pulmonologist, we were managing in intensive respiratory care unit. Our boss used to hit us if we give more oxygen. You are going to kill that patient with ventilator. That was his teaching. So I was lucky to get a great teachers during my post-graduation time doing the MD. And KM was well known for that. And I really thank God that I have been there and I was destined to be a homeopath, and therefore he made me learn allopathy to the depth core. It's a great science with a foundation of knowledge, everything. But when it comes to medicines, the side effects restricts that, and many times doctors get frustrated. I was also getting frustrated, but we had no choice than to use the protocols. So protocols also needs to be changed. Even in allopathy, when the fixed protocols are given, I used to change. If instead of 500, I used to give 250, and my patient never used to suffer from more side effects, lesser side effects. And I used to get even good success in allopathy that time. But all this mother's case has totally changed my mind. I was so happy that I found the medicines without side effects, giving best results in shortest possible time. Was a great achievement for me that time. And it's really hilarious. Oh God, you have given me the gold mine. Homeopathy is a gold mine. If you know this, then no one will leave the homeopathy and go. Only what is required, lacking, is proper teaching and taking the science ahead of the modern times. We should not be like short-minded, broad-minded. If I was not broad-minded, I would not have come to homeopathy. Even allopathic people and homeopathic, if they integrate, it will give the best results. I can guarantee you. In such cases, with all the life supports and minimal use of the allopathic medicines with homeopathy, improving the vitality, the death rates will go down, morbidity and mortality will come down. So never give 100% oxygen from 5 liters. As soon as the oxygen used to come to 92, 93, I should reduce one more liter, half liter, one more liter. It was a very tricky management. But because of that, lungs didn't get injured. No one will die at a PO2 of 80. I have seen patients with a cardiac disease where there is a chronic hypoxia of oxygen of 40 used to come first floor on my clinic at Jalgaon. He used to get breathless, but I said, how come you are surviving? That means what we have been learned that if oxygen goes low, you will die. No, it is not like that. This case will teach you so many things that you will understand how to manage. And it is really mind boggling. So this was a same patients after the treatment. We had no, because that there at this village level, even blood was not possible. This was not possible. So I was treating just clinically. At the end, when we did, It was a severe pneumonia. But I said, Namo, come on now, you got well. You come to get a CT scan done. Let me see. So only for 5% score came. It would have been 25 that time, but it has reduced so nicely. And this was a success of this story. This was see, I have given how I have added the medicines, prescription follow-up. So with these symptoms, what is a change? What was a characteristic cough symptom of spongia? During sleep, he used to go breathless, so lachesis was added. Digital is to improve the heart. China horse was given so that China horse always improves the vitality that I have seen. And Baptisia improves the globulins. So if the globulins are low, that means your immunity is low. Baptisia put 200 in a water, give one teaspoonful till the time fever comes down every 15 minutes. It improves the immunoglobulins of you to fight the disease. So you have to think homeopathy in such a way. And you see this marvelous recovery of feeling energetic, sleeping well, throat red and dry cough was going on, bryonia was repeated, and it is to give relief. Again come back, again repeat the bryonia. So it was a lot of time till the time, one time on 28/9/20, he came into such a bad condition that he was breathless. So it was like a left ventricular failure. Now, this is all clinically, there was no ECG, nothing. But on the clinical knowledge, I thought, oh, it is left ventricular failure. Lauraceris 30 immediately gave relief by increasing the strength of the left ventricle. Now, this is not given anywhere in the books, but from the analogy, from the clinical experience, from the modern science knowledge, and what, if you read this Lauraceris Materia Medica, you will come to know exactly, at least which clues by that you come to know that this is good in left ventricular failure. So wherever the medicines were required, I was not shy. In नहीं अभी ये remedy दिया अभी ये नहीं देंगे. Though you have to act fast, otherwise this case would not have survived. Again, I would have faced one big failure and frustration. So oxygen improved. Finally, patient improved. To complete this, that time he had a respiratory weakness, muscle fatigue, and all that things. So what I did, I give Stanum 30. It works well for the respiratory muscle fatigue. I'm going to give you maximum today because I have to give a lecture for 2 hours. And I said, today I got a time. Thanks, Manish, for that, because many times I have to be very fast. I got n number of cases to show you, but the time was short and everywhere I couldn't tell you. So many times I used to get a message, sir, आप potency नहीं बता रहे, ये नहीं बता रहे, because time is short. Today, I'm literally giving you everything that I have done. So, during that time, why Calcarea austratum was given, why Lycopodium was there, the recovery. His constitution was Lachesis and Lycopodium. Lachesis followed by, but I have given that at the end. And that's the reason there is total change. So change of symptom from lungs to the knee pain. So it is a good or not? It is good because it's the middle layer. Till the time it comes on the skin, I get every cure with a skin or dental problem. Dental problem is wherever the brain is involved, you give right remedy, patient will start getting teeth problem. You will go to the dentist, fall back to the original disease again. And that's the thing that you must know, and you should share with everyone what I have told to you. Because unless you share and make homeopaths strong, they should be more stronger than me in prescribing and getting results. Only then homeopathy will come up. And I want this, all teachers, it's my sincere request that the colleges, at least in third and fourth year of the whole BHMS, they should be only taught about how to give proper remedy, how to show the results. You take camps if you don't have patients, but unless and until you make that student prescribe the medicine and see the result, हा सूर्य आणि हा जयद्रथ दाखवल्याशिवाय होमिओपॅथीला लोक मानणार नाहीत, सोडणार नाहीत. तर त्याच्यासाठी दिस अ रिक्वेस्ट फॉर द टीचर्स that at least we have to develop all the homeopathy in a modern science form and help each other. See, when I used to take this WhatsApp, so these WhatsApp messages, monitoring on the video, that degrade. So if you see oxygen is 36 in the left side picture, as well as ऑक्सिजन दिल्यानंतर मग त्यांचा लगेच त्यांचा बरा व्हायचा. सो these are the documentary proofs you should keep. Otherwise, no one will believe that you have done such a good work, and no one will give a damn to you. समजलं ना? So this is very important. So you see,
बोला.
now you
हाँ,
see the
बोला.
series. This is the final recovery.
सुरुवातीला 2-4 दिवसाच्या अगोदर खूप त्रास होत होता. चालता येत नव्हतं. जीव खूप वाकत होता. बाथरूमला तर जाताच येत नव्हतं. परंतु आता या 2 दिवसामध्ये खूप फरक पडला. आता तास तर चालता येतं.
The initial 2 days खूप फरक पडला. See what was his condition. See, 57, 45, you can see that how much bad it was. And from 57, 65 to 70, if you can see the change. And now it has come to much better. Even oxygen 2 liters is maintained. You see the oxygen cylinder, you can see that 2 liters is going on. And final recovery, I have shown you this case.
हाँ, बोला.
So learning from this case highlights the critical health conditions in remote areas with limited access to medical facilities. Homeopathy can do great wonders because no doctors are there. So those who are staying in the periphery, they can literally save the patient. With that happiness, you will see homeopathy grow with the name and fame of the success. It underscores the importance of quick and proactive intervention, such arranging of oxygen supplies in emergency. Therefore, all doctors in homeopathy, they should have oxygen cylinder, at least one cylinder with them to take care of the emergency. The combination of Bryonian carbovage with conventional oxygen illustrates the value of integrative approach life supports when managing hypoxia and COVID-related symptoms. Continuous monitoring and communication is very important. That proved very essential in assessing patients' progress, adjusting the treatment accordingly. The challenges of maintaining adequate oxygen levels during movement can be mitigated by simple solutions. Understand simple solutions. Giving oxygen was a simple solution along with homeopathy. So Bryonian carbovage used to sustain the action. So therefore, this combination proved to be very, very beneficial to me. And close monitoring is always the key of the success. Now we come to second case of an elderly person who has recovered from COVID, but it has gone into GB syndrome and with integrated care. He was in ICU with recurrent UTI. Recurrent UTI has always happened when the bladder is not ejecting all the urine out. So the stagnant urine is always a source of infection. So these patients, they get recurrent UTI even. So 4 or 5 times he was admitted to ICU. Finally, they say कि इसका immunity इतना कम है कि whether he will survive or not now, we do not know. And at that time, he's a father of a very intelligent son staying in Singapore. He searched me and then he contacted me and said, "Sir, this is the time where we got stuck up. Stuck up. So this is a stage where I want the help of homeopathy. And I thought that you will be a better person to guide me. Always don't give high hopes." I said, "Okay, I'll try my best to the best of my knowledge and ability, but I can't guarantee you anything because science, every science is not complete. Every science has got limitations. Every science has got this. So don't stop allopathy. Don't stop conventional medicines because they are life supports. You have to buy the time. To buy the time, let it go. Only what problem comes is adjusting of their doses with our doses. because the toxicity and side effects needs to be changed. And that that too in this type of case, I say if they allow you, they say कि sir, they say कि अभी कुछ नहीं हो रहा है, तो you can try whatever you want. And he had an even mastoiditis with sigmoid transverse sinus thrombosis. So it was a very grave case. And already he had an hypothyroid with recurrent UTI, septicemia, so not responding to the usual rule of antibiotics, that there was a antimicrobial resistance and all that. So these slides are been written by his son. I said, you give me your opinion in front of in form of a slides. I have to present this case. And he has written all this. I have not written this. So with 79 long COVID developed GB syndrome and in the bad health since he was at for more than 3 months for COVID with COVID complication. Post-COVID, he developed an headache and later on upon investigation found to be osteomyelitis of skull detected in Jan 22. Owing to the age, and he was very much weak himself fighting with the COVID and disease and ICU management. So they say now what is there. Anyway, we have finished with everything. There are no hopes, and you can take the patient at home and give IV at home for more than 3 weeks and then stop. Whatever the final fate was explained to him, and he was sent home. The condition further deteriorated and he couldn't move even from the bed. Again, he was admitted to ICU 7th March. For over 3 weeks, one more round of the standard treatments were given. They referred to the ENT, neurologist, neurosurgeon. All that was to medically manage osteomyelitis was so difficult. Osteomyelitis, the best drug that I have seen is acid phos 200. So surgery at this age would be dangerous, was told to him. Again, where allopathy ends, homeopathy begins. So discharged with IV antibiotics again, with high D-dimer, CRP, colon polyps, fissures, disorientation. So everything was haywire. In the hospital, 3 people were required to move him and couldn't even stand, was advised to continue physiotherapy at home. IV drips, I said you continue the IV drips and injection for anemia so that, vitals में hemoglobin, blood pressure, pulse, all there. What is vital force? We have learned vital force. So what is vital force can be defined into a scientific term as the hemodynamics and physiology. With good hemoglobin, the vital force is good. They will respond to the medicines very nicely. Then this led to the weakened nerve, nausea, constipation, elevated CRP reducing at slow rate. Daily physiotherapy sessions were there, but was not helping. So finally, I selected a protocol. After studying this case and then making a repertorization, I said this type of remedies that are coming. So you make a list: abrotenum, mercurius dulcus, all after because the ear problems, mercurius dulcus was more because there was a mastoiditis at the behind the ear. Okay, so that therefore Mercury Dulcus was selected. Natrum Mure, he was long time unhappy. His son is living in Singapore, long time. So it was a inner silent grief for a longer time. Veratrum Viridi again for given for low BPs, falling of the BP. As it was, I have already told you for osteomyelitis. Arnica is the best drug you should add in all these serious cases because overall improvement of arnica after any injury, whether it is mechanical injury, whether it's a vascular injury, shock, everything. Arnica is the prime remedy. Unless you give this, you will not get a faster results. Baptisia, I already told you, belladonna for acute congestion. There was a bleeding, so Crotalagus horridus was given. Ferrum was again to improve the blood vessels. And hepersulfonam always gives rise to, it's a broad spectrum antibiotic. If you say abscess, everywhere hepersul works wonder. So now where the analogy, I have done this and started with this. There is no constitutional remedy. I will select it later on when the patient gets stabilized. And the fine balance, he said, what is the fine balance? slowly tapered off all allopathic medicines. Only conventional medicines for thyroid, diabetes, blood pressure were continued. Now, this is very important. Many homeopathic doctors stop, and sudden there is a chaos in the system. Vital force goes down because at least they do some control on deterioration of all these things. Once the person is better, you can start tapering. That is what I do. Don't suddenly stop. Stop three medicines to one, but keep on checking blood sugars, blood pressure, TSH. Even you can check the TSH every 15 days. I check, see what is the change, and that is how you can be sure about your treatment. Only patient को अच्छा लगने लग गया, patient खाना खाने लग गया, patient को भी energy feel होती है. No, that is good, but it should be at a pathological level also, and there we have to keep a watch for any new elevated symptoms. Emergency homeopathy medicines were administered, and that helped very nicely. So you see, now this emergency homeopathy is for stipulated time, that is for 2 days, 1 day, and in series at a 1 hour interval. Select the symptoms of acute, do a repertorization, form 5 remedies as per the main symptom, generality, pathology, and physiology. You will get a protocol. You will take time to learn this. Minute, if I get time, lot of time is. I wanted to start coaching, but time doesn't permit me. I will teach you all clinical and everything later in the years to come till the time I get stabilized with lifting the homeopathy. Oral antibiotics were started, our homeopathy continued. I said, give that antibiotics because the WBC count is low. There is a lot of infection, vitality is low. So here the integration works with a fine balance. But the dosage should be instead of 500, give to 50. It doesn't cause drug resistance that I have seen even in the integration that had done initially at the start of homeopathy, where I was not knowing organon. So conventional medicines along with homeopathy continued for 4 months, and clinical investigation conducted routine basis, and all reports had come normal. So that was the beauty of management. The whole follow-ups will be given, balance improved, good improvement. You see how many medicines I have given over a period of 2 hours or 1 day, 2 days, 3 days, 5 days, 7 days is a week. I always take. So one medicine on 1 day. If there, if the space of the disease is not very fast, then you can give the same remedies 1 day, one remedy, or morning, evening, one remedy, or only one remedy with 1 day gap, depending on what the case and how fast you require the remedies. Don't be shy to wait and then give because by that time patient deteriorates and finally homeopathy fails. So before patient was completely disoriented, had to be bed, brush his teeth, toilet pan, bed, to had to wear diapers, heavy nausea, disinterest in watching news or reading, could not sign and withdraw the pension for months, could not engage into a meaningful conversation. But after homeopathic treatment was added, patient is fully alert, can be differentiated day and night, takes bath, shaves, brushes his teeth independently, walks to the toilet, goes for an evening walk without support 30 minutes a day, reads newspaper and watches news, can sign, help in sorting society matters also. Is how great recovery we are seeing now. And attend family weddings and this. This is called the beautiful and the best results of proper integration with minimal conventional medicine and regularly to the point every day or every 5 days or 4 days, watch on a patient and only this comes. So what is the learning from this case? The learning is the holistic and integrated approach to treating complex, multifaceted health conditions in elderly, combining conventional treatments with homeopathy, with a regular monitoring, had just led to the significant improvement in this 69-year-old man with GB syndrome, osteomyelitis, multiple comorbidities. So early intervention and personality, both medical and complementary therapies, helped in managing the symptoms, improving the patient's quality of life, and this needs for the no needs for the further invasive procedure. So you saved so many surgeries, so many miseries, and everything was fine. So this is what is the second case of long COVID with nervous system involvement. Third is my own case. This time was the time again, second time in my life. Like my mother was on a deathbed, I was on the deathbed, and with oxygen of 80, and with 80 oxygen, I was unconscious for 2 days, not fully unconscious. Say, miss only when somebody used to touch me very hard, I used to open the eyes and close it. Open the eyes and close it. My daughter is already doing MD in skin, DY Patil. She came fast. I had told her a year back, ki, Aishwarya, you need to learn homeopathy. She said, Papa, don't confuse me. Let me away an allopath first. Then I will be into homeopathy. I said, but now if this COVID is going on, with God's grace, I have not suffered even after going to the COVID hospitals to give the treatment. But now my sixth sense is saying, "Ki I may get into the problem because I had lost 8 kg weight working day and night, not eating properly, not sleeping properly. So my vital had gone down. I felt if I get into a problem, no one can prescribe what way I am prescribing because everyone is closed into the classical management during these acute times. So she said, okay, I gave her protocol. I gave her protocol and for everything. I said, this happens to me. These are my remedies because I was knowing what remedies I may require. So 1 year advance, I had forecasted and given in the 2 years back. This was a story. And a day I was down with fever. I didn't get up only. And then everybody said, "Ki, he doesn't sleep such a long time." Then my son noticed, oh, I have got a great fever. And he immediately called Aishwarya. She came. She started using the protocols given to her. She is not an homeopath, but that protocols worked on me. And in my fever was 104.2. I said, never give me paracetamol during fever. I said, why, Papa? I said, fever never kills. Fever kills only when the fever goes above 105. Fever comes to stimulate your immunity. It comes to stimulate the immunity as well as it improves the body's functions. And therefore, never bring down the fever with paracetamol. Never be afraid of it. It will come down when the disease will mitigate. She was giving me, and finally, with that, fever came from 104 to 102.2. It remained for whole 1 day. Then at night, again, it started increasing. So I told her, if fever doesn't respond, it comes down and again goes up. That means you require intercurrent remedy. Tuberculinum, give me 200. That was written in the protocol, and she gave me tuberculinum 200 was not available at home. She gave me 1 m. And within half an hour, I was sweating, and fever came down to 9900. I said, let it be now. And I came to my senses. Then I realized that every time the fever used to go from 99 to 100, 100.8. As soon as the fever used to rise, I used to feel sleepy. So sleepiness during septic fever. Fatak says only one remedy, stramonium. See, now here individualization come. One thing that comes out, you pick up that and prescribe, and the case goes more smoothly, faster. Stramonium 200 was given to me. And immediately I became alert within 15, 20 minutes. And she said, Papa, you're not fully awake. I said, thank you. But then we did an X-rays and everything. It was found that 4 pneumonia patches, both lower lobes and upper lobes. It was frightening for me, but I said, don't worry. Homeopathy is at your next door, sitting to save you. So don't get bothered. But I told her, but as a doctor, as a human being, you always are afraid of your own death. So I took Aconite 1M. That lessened my fear of death. And I said, come on now, we do the blood investigations. Did a blood investigations, and it was haywire. I'll show you that with obstructive jaundice started on third day. And the cholesterol, bilirubin was rising every day, every day investigations I was doing with congestive heart failure because of secondary pneumonia. So you see, this was an acute. I do not have heart failure, but it came as an acute. And therefore I said, now I have to be very, very careful. in taking remedies and getting more to the pathological remedies. Otherwise, it will land me into an ICU. Aishwarya had already given me Bryony and Carbovage. My oxygen improved to 90. But for safer side, I said you get an oxygen cylinder. Then there are 8, 10 postgraduate doctors in my family. We have got a very big family. Everybody was saying he's a adamant man, not listening. He will die at home. Take him to ICU. I told Aishwarya ki she also fought with me. Papa, if something goes wrong with you, I'll hate homeopathy throughout my life. I said that day will not come. You don't worry. Homeopathy is great and only homeopathy is going to save me. But she was crying. I said, okay, don't cry. For you, your satisfaction, I'll come to, uh, I'll get admitted into ICU. But I have seen all the big people in homeopathy gone to ICU had not come back. So I said, then give me one promise. If something goes wrong with my life there, then don't regret your decision. Ki I should have listened to Papa. So she said, "Ki otherwise you will live in frustration. Anyway, if I have to die, I'll die anytime. That is not a thing. The day time comes, no one can save anyone, even if he is God." So I was then into the very big thing. Ki now what to do? She realized, she called my son who was out of India and Swaraj. He said कि पापा जो बोलते हैं वो करो. पापा को बहुत ज्ञान है और वो अपनी लाइफ रिस्क में नहीं डालेंगे. He knows everything, so he will not put his life in the risk. And finally, she agreed and we started the treatment. Now you see this fever chart. Systematically, I had done 100 and I think it is not very well visible, but high grade 104 fever, breathlessness, extreme prostration means even to sit up in the bed was not possible to me. But if you see from 3rd Feb to 7th Feb, how the fever, the red lines is coming down. So every 20 minutes fever was measured and this graph was a trend line for the fever. So you can see the fever declining, rising up, a final decline. Then you see all these investigations arranged into an Excel sheet. CRP, the red ones are all abnormal. The green ones are coming late. So if you see 2nd Feb, 3rd Feb, 4th Feb, 4th and 5th Feb, everywhere it was red. And finally, it came down to normal in almost about 10th February, it started coming down. So from 2 to 10th, that is 8 days, I was 80-90% recovered from everything. My hemoglobin from 13 dropped and finally it again went to 13, 12, 12.4. And most importantly, you see the CRP. CRP reduced in 2 or 3 days time to from 263, it dropped fast to 119 and finally it came to 34. Okay. And then it, over a period of next 7 days, it again resettled. The WBC count was 26,400. पांढऱ्या पेशी वाढल्या, पांढऱ्या पेशी वाढल्या. किती घाबरतात लोक. पण पांढऱ्या पेशी वाढल्या means I said my immunity is good, that my WBCs are on such a higher side. So I am protected with the WBC. So don't bother about that. It only indicates when WBCs are high, there is a severe infection. So that is just for our knowledge. And finally, it came down to 8,800. And the bilirubin, which was rising so fast, see the direct fall in 2 days' time after Chilidonium 200. And this was a recovery of case. And I had done an extensive study of this. And I was close watching this myself also. My daughter was non-stop sitting with me 24/7. And we were monitoring each and every symptoms and taking. So you see this CT scan, you can see the whole recovery faster, even in the radiological shadows of the regularly every month I used to take because radiological shadows they remain. Not even the remnant of scar of the pneumonia was there, and that was a complete recovery, clinically, pathologically, everything. So on this totality of symptoms I had worked, and the final treatment protocols was given. Merc 200, Heparsol 1 m, arsenicol 200, Bryonian Veratrum V, because my BP was falling down and I was feeling very, very sleepy with septic fever, Stramonium 30. And addition of extra remedies as per the symptoms they come. Oxygen drops, carbovage was added. Now here, carbovage was given SOS. As soon as the oxygen drops, give carbovage 30. And if it is not improving after carbovage 30, first give Bryony and then carbovage 30. Because inflammation, unless and until it is taken care, is not going to support your carbovage. So you must have this pathological knowledge. Then you can prescribe your homeopathic remedies fantastically. Now, here I would say one more thing, that bryonia was a trump remedy. Why bryonia? You see, all serous inflammation of the tissues, wherever there are serous tissues, inflammation causes response to bryonia. You see the accumulation of fluid in the knee, the accumulation of in the pleura, fluid in the pleura. Inflammation के बाद accumulation होता है. So bryonia works the wonders, and it is really a trump remedy in all sorts of serous effusions. That is, even wherever it is in the lungs or pleura or in your knees. So now the fourth case I'll come to, a long COVID uh, case of mucormycosis. In mucormycosis was such a bad case that I was myself said, what to do? Resistant to all allopathic treatment, that recovered completely only with homeopathic treatment. This is a learning case for an homeopathic. What is the scope of homeopathy? We have limited our scope because we are not giving remedies as per the modern thinking with whatever. Dr. Henneman's time, IL-6, CRP, all these tests were not available. If he would have survived 100 years more, today the homeopathy would have been at some topper position. Because wherever he has left, we are just praying. We are saying, thank you, Dr. Hanneman. But his soul must be crying. My children are not taking homeopathy to the next level. What he understood during his time, 200 times, years time, and what is the now time, that now times needs to be fulfilled with the same legacy of Dr. Hanneman or the same principles, slightly changed, because he also changed from first editions to seventh edition, if you see. But after that, no one dared to be wise. And that one word has given me strength to use these remedies properly. If you remember Dr. AGD, who was a pediatric surgeon, his disciple, first his patient, then a disciple. During the last time of Dr. Hanneman, he said, Sir, I have done one experiment. Please bear with me. And he said that I have given in repertorization, one remedy was covering some symptoms, another remedy was covering some symptoms. So I gave two together, mixed and given. He mixed it and given that two remedies at one time, and he saw the good results. So Dr. Hanneman was thinking, oh, this is good. But he said, now we have fixed principles, so we cannot deviate. This is a true story. You go on the internet and read the autobiography of Dr. AGD. Then you will realize, till the time I read this, I was always feeling guilty. Am I doing right homeopathy? Am I playing with the principles of homeopathy, of the organa? I was feeling guilty. I was feeling bad also. But moment I realized this, and then I read a word, dare to be wise. You know how that word came in front of me when I was regretting. But he says, mission of the physician is to cure the sick. And I was seeing the cure. So somewhere our knowledge is restricted in homeopathy. And we have to come out and blow out and dare to be wise to find out whenever you get stuck, whenever you fail, that is a time, don't regret, don't cry. Act upon wisely and see the change. Homeopathy will be much more ahead of the time. It will be a mainstream if everyone agrees and the research are done in that directions. So the neurological complications of mucormycosis, this long COVID on a very heavy dose of steroids, finally suffered from mucormycosis with right maxillary sinus and head pain, and was put on antifungal treatment. The fungus was growing rapidly in a cribriform fossa, so just next to the brain. It will go in the brain, patient will die. She was operated with no response. Deterioration progressed and was finally discharged. At home, she developed thrombotic infarct in the brain with complete occlusion of intracranial part of ICA. So the artery was also blocked. Now you see what is the condition of this patient. It was such a bad. Then they called me again, like that patient. Ki sir, kuch hopes hai kya? Everywhere hopes are lost. I am called in. So it becomes a mind-boggling job and tiring job for me. And continuously working brings down my health, and I have to suffer. But anyway, I have to suffer for the good cause. So I say, don't bother. Just keep on working. Just keep on moving, and see that whatever knowledge I can transfer it to you, you people can take the work ahead. That is my internal real feeling. Therefore, I am sharing everything. There is all transparency. Even my failures I am sharing. Even why I use this are sharing. So it is for us a long session to debate on this and then work accordingly. So you see the things, the hyperintensity is along right maxillary sinus, sphenoid sinus, then maxillary sinus, hyperintensity seen in the right, hyperintensity, the cleavers. So it was a whole spread of the mucor mycosis. And here she was given more than 40 amphotericin B, and still she did not recover. Then the amphotericin was costly. She was shifted to civil hospital. From there, again, they say ki now it is not available and she is going down, down. Take her home. At home, we started the treatment. And finally, uh, uh, I started a treatment with cerebral bellar atrophy, patchy, small patchy parietal lobes, right centrum ovale, and suggestion of non-hemorrhagic infarct. So there is a brain edema. Now, brain edema when comes, now, so whatever remedies you are giving, you as per the symptom similarity, but always add this, because unless the brain edema, if you have selected homeopathic remedy does not work on the brain edema, it will take longer time. In the longer time, patient may dip. So what is our role? Dr. Harriman said, rapid, gentle, permanent restoration. So think of rapidity. Rapidity in acute case is not 24 hours, 48 hours, 1 hour, 2 hour. That should be the rapidity. Minutes. It starts from minutes to the hours. So mild generalized, this severe case with thrombotic brain edema was there, and it pointed me to use APIS. APIS given works so wonders that whatever remedies that you have selected well as per the symptom similarity, it works wonders and you get the best results. So post-operative MRI showed inflammatory sinus and resolving inflammation on, but signs of early osteomyelitis. It also shows complete occlusion of this, such a severity of even after operation was there where we started. So this is a short story. It's 12:19, so I got time. Developed with a COVID pneumonia and CT score of 12. And everything was so, she at home, she further deteriorated and started developing neurological symptoms, diplopia, incoherent speech, severe weakness, confusion. Huh? Even that they used to say, ki, chalo, chalo, ammi, chalo, chalo. She used to fall down. And we stopped all the amphotericin and heparin injections. I said, no, just be on homeopathy. Let us see now. Anyway, it is not helping. So to keep it on was of no point. At this time, the relative request me to start homeopathy. She was in stupor, delirium, extreme weakness, uncontrolled diabetes, and severe headaches. Can you imagine uncontrolled diabetes, 200, 300? It was a grave situation, but I said, dare to be wise, dare to be wise, dare to be wise, and use as many homeopathic. Anyway, she is dying. And finally, with this treatment, uh, her CRP came coming down gradually. Finally, it is came CRP reduced from 180 to the lesser side. Sodium improved because of that. Sensorium improved, and finally the remedies that were given were Merxol 30, Heparsol, Bactisia again for immunoglobulin, Epis for brain edema, mycositis, inflammation, arsenic album, antifungal, hyoscyamus for the delirium symptoms. Now you see, All these remedies has worked in, see, complementary. Why there are remedies? Give one remedy, follows well remedy, complementary remedy, associated remedy. Why it has been given? Only we are not taught ki how fast we should give the complementary remedy. This in chronic cases where we have got time, आराम से बैठो, 7 दिन के बाद दो, 5 दिन के बाद दो. But in this type of cases, you have to use time minutes, hours, not days. So you have to be wise. You have to be wise, and then only we can have a good outcome of homeopathy. So all these remedies were given, placed at 1 hour, 2 hours. Then once she is getting well, every day, alternate days, like that, we continued the same things. And this was before treatment. See the she is into such a delirium. She was muttering and she was not sleeping also properly. I have done such fast forward because she could not stand walk. She had fallen down. And now after 4 days she started getting up on her own. That was the improvement. It's a very long video, so fast forwarding I have done. Now see, she is getting up, walking, doing her rituals of her religion, and finally she is getting better, better with a stick now. She's walking with a stick. She's walking with a stick, and now after everywhere she's walking, now she started taking hisab from the daughter-in-law. So her mentals improved. Now having a cup of tea with all the discussions with the family, and that is a beautiful recovery. That is a really remarkable recovery, and showing the dynamic power of homeopathy. Why I am into love with homeopathy? I was an intensivist as a doctor. Such a type of improvement in such a shortest time and such a great recovery I have never seen. Homeopathy gives me lot of happiness, job satisfaction. It gives me less money than allopathy, but the wealth is not important. Your happiness is important. That you get by treating such type of cases. I don't say that I treat all cases successfully. Even today, I have to face failures. I have to come out, find out why it is. But as my age is growing, now I'm already 64. So there are limitations for me, and tiring work is not possible nowadays because I hardly sleep for 4 or 5 hours, and therefore I have to maintain my health also. So this was a final. You can see so good recoveries there. She's talking to me on my uh, video. This is how I used to check them. Show your tongue. Tongue is very important. Show the nails, show the hand. And this is how some things clinically you can even do on a video call. So that is a great thing that has happened. Now, this is another case. I will be finishing short if I have time. I have time for 20 minutes. So I'll be again discussing whatever I can cover today so that it will be a great learning to the students. And then I can learn from them out of their experience. So they have to share these cases on common platform so that other homeopaths also learn and I also get a feedback. So learning with each other will be a great thing in homeopathy. I am not great. Everyone is great. Everyone can get this result, provided they dare to be wise and use the knowledge of modern science and start treating the cases. This was a case of severe head injury on the road accident, and it was so bad, skull was damaged. Finally, one parietal bone was replaced with an artificial. Then they started treating him. Hmm? And after treating this patient, he was fine for about a month in ICU. And then suddenly there was sudden rise of the brain edema. It increased so much that it was difficult for them to manage this case. Give steroids, then glycerol, all things that are required in conventional science were given, and that brain edema was not reducing at all. So the brain started ballooning out of the skull bone, and therefore they had to open that artificial bone so that brain doesn't get damaged and compressed. Now, this was such a severe condition, and finally they said, "Ki there is no point keeping in ICU. You take him home because here were the allopathy ends. And he was discharged against medical advice with the rice tube and urine bag, and everything was removed. And that ambulance came to my hospital on the road. I had to go down and see him in the ambulance. I said, my God, how can we do this? But again, dare to be wise came in my mind. Dare to be wise. Anyway, everyone has given up hope. You must try on such patient so that you discover many things, the powers of homeopathy by treating such cases. This is a bilateral temporal region. Encephalomalacia changes. Means what is encephalomalacia? This bone becomes so soft, soggy. There is nothing. Extraocular dilatation of the adjacent lateral ventricles, sulcal spaces, suggests volume loss. Volume loss, brain softening. What can you do in this with homeopathy? There is nothing. There is nothing in allopathy also. Now, such type of case, I said, no, dare to be wise and try to treat and see what is outcome. And totality of the symptoms that now you see where what symptoms I have taken. Coma, moaning from pain. He was just it's very small. So I said his vitals are good. Even the brain is gone, but vitals are good. And homeopathy can do wonders. The confidence in me. I say homeopathy. I do not know. I got such a confidence in homeopathy. It has given me 80% of the time success in all this such type of cases. Not 100. Huh? I don't claim extra. No extra claim. But whatever is, I'm honestly telling you, being transparent so that you understand the powers of homeopathy and take the homeopathy ahead. So these were the simple symptoms of totality I had taken and started. And now you can see. See, he's into a very unconscious state. What to me? There is no life left. But one thing of the vitality that I say, after 7 days time, he's sitting with a rice tube. He's moaning now. And after next 7 days, he is standing. Huh? He is blunt. He cannot talk. But the see how he is walking with the urine bag, even doing puja with the urine bag. Okay. And this is how I seen the recovery. The rice tube is out now. And now he started writing to see what is his. Then he started exercising at home. All this happened in 4 5 months' time. And now see the final recovery. Here you feel कि yes, होम्योपैथी में दम है. होम्योपैथी में कॉन्फिडेंस होना चाहिए, दम है, and it can improve the person who was going to die to such a healthy state. Here, rapid, gentle, and permanent restoration you can see from this last video. It's really, it is so satisfying. It is so satisfying, and therefore we must always never give up hopes in homeopathy. Unboundless, unbounding power is there in homeopathy. Only you have to use your brain, your knowledge, and your daring to treat such cases. And be clear. I said, I do not know. I am not giving any guarantee. You want to take the treatment, take. I don't want any other complications. They say, ऐसा भी तो सर जा रहा है, please करो, जो करना है करो. And such cases has given me a great confidence. Then another case. I'm little fast so that I can show you multiple cases today. We will utilize our time to spread the knowledge and spread the powers of homeopathy, what it can do, so that everyone will start dare to be wise. But after proper understanding and having communication with the relatives. Otherwise, if you give hopes, नहीं नहीं homeopathy करेगा नहीं. Homeopathy देखो, there is 1% ray of hope and rest 99 is God. I'll try my best. If you want, I'm not giving you anything. Because 1% hope, because God is there. The universe, nature, power, you do not know. That is a big topic where I've gone. I've studied 116, 17 sciences. To understand wherever you get stuck at one place, find out a solution. Don't just give up and say, oh, gone. It's not my cup of tea. So you have to be very, very wise and bold and taking strong decisions and taking a risk also. Taking a risk also. What happens? Nothing. You're not doing anything wrong. You're not killing anyone because he's already left to die. If you treat those cases, the world will understand. And these cases should be reported. That is what one has to do now. And this was a pulmonary 15-year battle with my MDR, fibrocavitated tuberculosis, with aspergillosis infection, the worst case in the TB. And he was almost with a skeleton reduced. Whether he will survive or not, that was the problem. When he came to me, he had all these symptoms that was very common. 2005 recurrence of tuberculosis, second line treatment started. 2009 again relapse, time followed. Even he did not become AFB negative. Huh? Only on the first time it became. Then after 4 years he again relapsed. Then treatment, this time followed a sincere treatment till 2010 without any relief. But after that, he was not getting relief with the side effects. So he had left. अगर 2013 तक the tuberculosis was persistent. And he said कि जाने दो अभी मुझे कुछ नहीं करना है. And the patient was left up hopes. In 2020, diagnosed with MDR, multi-drug resistant, started on conventional treatment. And still, again, the third or fourth line was start. And uh, the acid fast bacilli were still positive. Hence, now somebody suggested him start homeopathy, where there is an end to this treatment. The start is of homeopathy, and uh, programmatic management of drug-resistant tuberculosis was also done. And you see, still the AFB was detected. And after treatment, that is after treatment with homeopathy, after treatment with homeopathy, AFB became negative in 3 months' time. AFB not detected. So that is the strength of. Now there are such a big problem all over the world of MDR tuberculosis. I said you continue whatever is given. Anyway, you are taking, not getting relief, but there is a satisfaction. Yes, I am taking this treatment. Let them take, because it's a conventional science proved in the protocols and everything. We are at the evidence level. So we, something goes wrong, they will say कि इसने ये TB का दवा बंद कर दिया. Anyway, for 10 years he was taking, he was not responding. So I said, don't take a dual advantage. और एक बात बताओ, good part of allopathy is that these medicines are acting, but the resistance is because of the disturbed immunity. और वही तो power है होम्योपैथी का, immunity को, vitals को बढ़ाने का. The same medicines give results very best with the integration, fine integration. I remember when I was an allopath and I was into, I had my all indoor also. So one patient of resistant typhoid had come. So he was not responding. उस टाइम पे आई कॉल्ड वन ऑफ द होम्योपैथ. सर ये तो बहुत डिफिकल्ट, अरे तू ट्राई कर, मैं अभी अभी सीख रहा हूँ, तो आई डू नॉट नो हाउ टू यूज, या मुझे क्लूज दे, मैं पिता पढ़ता और देता हूँ. So he was not very confident, but somehow then I said I'll read the references and gave the very same ciprofloxacin, which was resistant, became sensitive, even in the culture report. Huh? So this AMR that is going on in the world, if they agree with us, this AMR can be solved, because many times to reduce the disease load, allopathy proves to be the best, faster. So if there is a tumor, you remove the load and give under the cover of, in cancer cases. I'll show you that case also. The proper integration works so well. So that's the reason I say कि जब बाप की जरूरत है तब एलोपैथी, जब माँ की जरूरत है तो होम्योपैथी. और माँ बाप दोनों ने अगर हमको साथ दिया तो बच्चे को कुछ नहीं हो सकता है. दैट इज द इंटीग्रेशन. द फाइनल गोल ऑफ इंटीग्रेशन कम्स विद दैट. All sciences are good. I am not against any science. I am against the limitations of the science. So somebody will say, ki, you are an allopath, you're talking against allopathy. No, that is not correct. I am not bad mouthing. I am just talking of restrictions, as there are restrictions and limitations even in homeopathy. So I am not against. These are my tools. जब AK-47 की जरूरत है लड़ाई करते समय, तो you have to use AK-47. जब सिर्फ पिस्तौल से मरता है तो क्यों AK-47 यूज करने का. So this type of combination will make the wonders. And you see the X-ray 24, 21, 26, 28, 35. See the clearance of the fibrocavitated disease. Today he is enjoying life. And about a month back he said की सर मला मुलगा झाला, नाही मुलगी झाली. म्हटलं लक्ष्मी आली, तुझ्याबरोबर हेल्थ पण त्याबरोबर वेल्थ पण आली, म्हटलं आता तुझं सगळं चांगलं होईल. दॅट इज द ग्रेटेस्ट सॅटिस्फॅक्शन ऑफ युजिंग homeopathy with this. Homeopathic treatment, what I had given, intercurrent. Fear of death रहता है, iconite. These are my standard prescription along with well-selected symptom matching remedy. But these are not to be repertorized. These are to be used when the patient is saying. And what is the use of so many remedies at such a fast time? The initial now I was studying my old cases when I was doing only classical practice. Single remedy, आराम से बैठो 7 दिन, महीना भर. And now same patient when came after my changed approach, that time he took 2 years, 3 years to get well. And now here, 3 months he gets well with that by combination of those remedies. So I understood to make it rapid, you have to use your common sense, you have to use your knowledge, dare to be wise and act fast. Don't think of left and right. Till the time you are facing this, after that mortality reduced, so many things reduced. Now, staphysia for bad feelings. Relatives are not understanding his situation. Arsenical anxiety for his children if he dies. Calcarea for pathological prescription for cavitatory disease. All 30 potencies. And to be repeated every week. Just don't give once and wait. In such cases, you have to repeat every week. Huh? Ferrum for 6C, because in this fibrocavitatory, fine capillaries they get damaged, as well as there is a anemia. So ferrum for 6C improves very nicely. Grief, he was in grief, Ignatia 30. Opium, always I add arnica and opium to the remedies. Why? Because if the remedies are not responding, then you give opium. Why to wait, Baba, itna? दे दो, कुछ नहीं होता है, साइड बाय साइड दे दो. पेशेंट रिस्पॉन्ड्स टू द रेमेडीज. तब तक राह नहीं देखने का, देखेंगे जब प्यास लगेगी तब कुआं खोदेंगे. काय को? बी फास्ट, रैपिडिटी चाहिए. सर बोल के गए रैपिड, जेंटल, परमानेंट. तो कहाँ रैपिड, कहाँ है? 3-3 साल इलाज चल रहा है, दो दो. तो वो क्यों चलता है? बिकॉज डूज एंड डोंट्स में जो होता है कि ये नहीं करना चाहिए. कोई आई मेड अ लिस्ट, वेरी बिग लिस्ट. Patient has to, those patients who follow that, they get recovery for a long lasting time. And therefore it has to be used wisely. Opium to improve the well selected remedy acting slowly. Spongia, incessant cough in tuberculosis patient, always it helps me. So give that SOS dose. SOS means जब भी खांसी आएगा ये ले लो. एंड जैसे कि लेते से ठीक होता है, वापस आता है 4 घंटे, वापस लो. SOS dose, whenever it occurs you take it. So these are the all follows well remedies that has been given. How I have given date wise, I have given you the takta of that. So learning from this case, complex case of MDR, fibrocavitary tuberculosis with aspergillosis, is a need of time for the whole world, and homeopathy can do wonders in this. Patients suffered frequent relapses over 15 years, eventually developed resistance to group 3 anti-TB drugs, along with severe side effects. Now from 2020 to 2025, still he is disease-free and symptom-free. The integrated approach, conventional with homeopathy, leads to a significant radiological improvement also. But that credit goes more to homeopathy because Calcarea phos works wonderfully in the fibrocavitary disease to reduce the scars. And if the cavity goes recurrent, खड्डा रहेगा, पानी भरेगा तो मच्छर पनपेंगे. लंग के अंदर खड्डा है, स्पुटम रहेगा तो उसमें फंगस ग्रो होगा. So all these things are taken care permanently. Otherwise, in the modern science, you have to remove the lung, pneumonectomy, if it is only on one side. But both side है तो फिर नहीं कर सकते. So now he has to live with the infection all the time throughout his life. And such a young patient will suffer or throughout the life is not correct. So these are the integrated cases. These are the cases where we have used in integration. So in integration, what we need a holistic treatment approach to reduce the side effects for better patient outcomes, cost effectiveness, and effective management of complex cases. So all this needs to be studied and all this needs to be researched in the standard guidelines and protocols That will help. So what is the need? You can see this girl. She's not girl. She is a 60-year-old woman who was in coma about 4 years back. And there I got a call from her daughter. My mother is in coma. You give me something. Doctor has given up hopes. So I gave her without history, opium 1 m and APs 30. And next day she opened the eyes. Brain edema come हो गया, confusion come हो गया. Opium gives the strength to the nerves. It was a magic recovery. Then she followed up with me. Then again, the daughter got transferred, and there was a gap in the treatment. Years later, she came to my clinic again, and in a very bad state. She was brought on a wheelchair in an already downtrodden state, and finally, she collapsed in my clinic with no pulse BP. I said, come here. Now she requires a revival and immediately take her to a nearby hospital. Till that time, I gave her Arnica 30, Cactus G 30, every 3 minutes, dal de, camphora. And her heart started thoda improving. And I said, come on now, we have got a time, shift her. We shifted to the ICU. She was put on ventilator. Then I said, that doctor, the chief of the hospital, owner of the hospital knew me and he was taking homeopathy. So I requested him, I want a homeopathy to be continued. There is always resistance from that side. So that fight till the time goes on, so many people will die. We should not fight. We should always see what is best for our patients. So what I did, I requested. She is a pulmonologist. She said, no, I will not allow homeopathy. So I said, let me talk to her. Madam, I am a senior pulmonologist from KM. You have just come. I know every management and homeopathy will save her life. If you don't believe, try and see what will happen to the patient. I don't want to take risk. I said, this is not taking a risk. It is very important that you allow us the homeopathy. Not allowed, then said she got furious and said, then you are pulmonologist, why you are not managing? I said, I don't have an hospital with now ventilator management. Otherwise, initially I was already doing that. So uh, I got wild because she is the patient who is going to survive. So I told this chief of the hospital, allow me to go to the ICU and I will manage ventilator now. That was jit pakad liya and say, ye kam kar, ye kam kar, ye kam kar. 4 5 drugs kam kiye. Finally, and I stayed there with her. Every 1 hour from my clinic, I used to come and see. Now it was a challenge. It was a challenge. And when there is a challenge, my blood boils. And I said, okay, God is there with me, homeopathy is there with me. I will not accept the failure. I managed her, and you will not imagine 24 hours that ventilator was out. Ventilator was out. I see reducing the oxygen supply, giving on the demand mode, changing it over, made this patient recover faster. And you will not imagine. Second day, she was transferred in the evening to the side room, and 4th day she got a discharge. So less time in the ICU, morbidity, mortality, and cost effectiveness in a lesser time. So I always request my conventional medicine colleagues and friends that don't be against homeopathy. Have a experience. If you have any problems, I'm always there to guide. And she's smiling there in the photo. After the homeopathic treatment, the dead patient was survived. And this is what happens. And this is what is the need of the time. So knowledge requirement, conventional medicines, pharmacology, disease understanding, physiology and pathology in homeopathy, anatomical and pathological rubrics. If you want, you can take a screenshot of this so that on this night line, first you develop yourself and finally you'll find that the world is yours. This is the last case I'm taking. Time is already 10 minutes remaining. So dare to be wise. This young guy with um, marriage fixed, and he was asked for a heart transplant. After COVID vaccination, he had problems. and he was suffering. Finally, his heart became so weak that his ejection fraction came down, global hypokinesia. And he was said that you need a heart transplant. And for 30-year-old pilot, he was 30 year, huh? All these symptoms of failure, gouty heart, mild diffuse atheromatous, carotids, dilated left ventricle atrium, that led to the postponing or cancelling of his marriage. The relatives came, ki, sir, uh, okay, can we go ahead? Can we go ahead for this operation? I said, it is your out to. No, we are not getting heart. I said, then okay, till that time you take the treatment. So what to do? I said, postpone, don't cancel the marriage. Postpone. If God is there, He will help us. He was on the conventional line of treatment. I said, don't stop that. Let that go. And 2D echo with finally improved to 40%. From it was 30%, 15 to 13% के बीच में था. Then it improved to 40%. And finally, in 2 or 3 months' time, it came down to 60%. So there is no need of heart transplant now. Then I said, okay, now you go ahead with the marriage. I attended marriage. I felt so satisfied that what homeopathy can bring happiness in people's life is unbelievable, unbelievable. And therefore, I so much vouch and voice for homeopathy that this is a real remedy that will save. I tried to start a conventional medicine with homeopathic medicine hospital, but unfortunately, my forms were rejected. My proposal was rejected. And my Deep Ganga Foundation, that is for research and development of homeopathy with alternative sciences, got lack of funds. It's stabilized to zero. And I'm still trying on my personal basis, on my personal income, to find out the real ways and doing research till the time I get a final solution. And homeopathy comes as the main thing. So learning from this, doctor eventually recommended heart transplant was the only option for that. Emotional stress, remarkable improvement in 3 months' time. 3 months' time, the heart transplant is averted by the homeopathic. और क्या चाहिए तुमको होम्योपैथी से? क्या क्या नहीं दे सकती होम्योपैथी? Homeopathy is wonderful, and that is the only thing the homeopaths needs to be thoroughly comprehensive diagnostic approach होना चाहिए. They have to check the patient. कभी blood pressure भी नहीं लेते, ऐसा नहीं होना चाहिए. You must always touch a patient, take blood pressure, see clinical signs, always do investigations, even repeat investigations. Just patient को अच्छा लग रहा है, वो ठीक है, उसका फिर फोन आया, वो अच्छा हो गया अभी. These are the हवा की बातें. No one will believe us unless and we show the proof. And therefore, I had taken hard pain to take up all this proof and put it today. Thank you very much. There is a lot of cases, but I think the time is, and I thank you. I hand over the mic to Manish. I think you must be long lecture, must be bored. My throat is also dry, mouth is also dry, and let us end here. Any time when the time permits. I got n number of cases to teach you, and we will do it anytime. Thank you, Manish. Thank you all for patient listening.
थैंक यू सो मच सर, थैंक यू सो मच. सबसे पहले तो सभी लोग चैट बॉक्स में डाल के सर के लिए थैंक यू डाल सकते हैं और हार्ट दिखा सकते हैं. सबसे पहले जो भी आपने शेयर किया, इट वाज मेस्मराइजिंग, और एक बहुत ही ज्यादा कॉन्फिडेंस देने वाली चीजें हैं सभी के लिए. हम लोग प्रे करते हैं ऑलमाइटी से कि आपकी अच्छी हेल्थ के लिए, और ऐसे हमें आगे भी आप गाइड करते रहे, नरेशन देते रहे, है ना. और ग्रेट लर्निंग, आज का दिन बहुत ही अमेजिंग था विथ. यस, कुछ क्वेश्चंस है, अगर आपको कुछ पूछना है तो आप हैंड रेस कर सकते हैं, सो दैट वी कैन डायरेक्ट वन टू वन क्वेश्चन. बट ऐसा हो कि शॉर्ट में क्वेश्चंस रहे तो ज्यादा अच्छा है. अदरवाइज क्या होगा, इट्स लेंदी, क्योंकि सर ने ऑलरेडी बहुत सारा समय हमें दिया है ना. तो क्योंकि लंच टाइम भी है, राइट. ये जितने भी कुछ क्वेरीज बीच बीच में आते थे ना, थोड़ा सा पेशेंस हमारे अंदर भी रहना चाहिए. पहले लिसन तो करिए, रिसीव तो करिए, है ना. अब मेरा आवाज आ रहा है, राइट? ओके. सो क्या करना है, डेयर टू बी वाइज सर का बार बार, क्योंकि ना ये मेंटर ही बता सकते हैं डेयर टू वाइज क्या होता है. है ना? कोई है ऐसा पर्सन जो अपना टेस्टिमनी देना चाहता है आज के लर्निंग्स पर? उसके लिए क्या करना जरूरी होगा? जिन्होंने वीडियो ऑन करके सेशन सुने होंगे, कुछ नोट्स बनाए होंगे, उनको बहुत सारी चीजें मिल गई होगी, है ना? विक्रम सर, विनय सर, भूषण सर, योगिता मैडम, किन किन ने लिया है नोट्स? हेलो। सो फाइंड आउट द पर्पस ऑफ लाइफ विथ होम्योपैथी, है ना? इट्स अ काइंड ऑफ ह्यूमैनिटी। जिसको ह्यूमैनिटी समझ में आ गई ना, उसको होम्योपैथी जल्दी समझ में आ जाएगी, है ना सर? थैंक यू सो मच। कल मिलते हैं। कल 4 से 6 के बीच में रहेगा। सेम लिंक रहेगी। डॉक्टर गौरंग गायकवाड़ सर हमारे साथ रहेंगे। कल 14 अप्रैल का दिन है, तो कल शाम को रहेंगे। वंस अगेन थैंक यू सो मच। और जिनको भी ये चाहिए क्या रिकॉर्डिंग, वो मुझसे कांटेक्ट कर सकते हैं, है ना?
मुझे भेज देना रिकॉर्डिंग।
यस सर, थैंक यू सो मच,
बहुत
थैंक यू।
सारे लोगों ने जो मिस किए ना, अभी बोले मैं आज बहुत लेट